All right. We're about to start in 5 seconds. We're about to start. Tutula? I think I'm going to ask you to drive this discussion because I'm getting an echo on my side. I'll introduce, but this echo is actually going to... I'll ask you to drive the discussion.
Okay.
Okay, we can go to Tula.
Okay, you can introduce us. Oh,
Okay.
Ladies and gentlemen, and especially to our speakers, thank you for being available. I would like to thank Dr. Fundi for putting this together. And in fact, I would like him to make that initial introduction. I am Tutula Balfo, and I work closely with Fundile on the issue of trying to do whatever we can to support the Eastern Cape. So he will introduce, and then I will facilitate. He will, however, need to keep introducing the speakers as we go along, because he is the one who did talk to you. Thank you, Fundile. Over to you.
Okay. All right. Good evening, ladies and gentlemen who've joined us via live broadcast on multiple social media platforms, Facebook, Twitter, YouTube, and the Dr. Fundi website. Today is just over 3 months since South Africa reported its first case of COVID-19, a case that came from KZN on the 5th of March, 2020. Now, almost 10 weeks later, the country's numbers for confirmed cases has gone over 50,000, and the deaths have just gone above the 1,000 mark, and the death rate is just about 2%, with about two-thirds of the deaths coming from the Western Cape. Now, in our discussions today, we are going to focus on the Eastern Cape province to hear more about the COVID-19 response to date. We're looking at what challenges are being experienced on the ground, and also look at what are the workable solutions that need to be put in place to strengthen the response. Today, we have people representing various sectors of the society. We have assembled a diverse panel of people representing the Eastern Cape Department of Health, which is Dr. Mtadegi Kamlashe. We have Dr. Ayanda Mnute from BCM, that is Buffalo City Municipality. We also have Mr. Nguleko Nesi, who's a veteran social justice and HIV/AIDS activist. We have Ms. Nomfundo Jajula from the National NPO Congress from King Sabata Daligebo area. We've got Mr. Jimmy Kotyana from Sangogo, from the Nelson Mandela Bay. But I would like them to introduce themselves, just a minute each. And then from then, my co-host, Dr. Tutula Balfo, somebody who originates from the Chris Hani district of the Eastern Cape, somebody who worked for many years in Umtata, currently with the Mining Council, what used to be called the Chamber of Mines, driving health interventions there. So I'm going to hand over to her.
Thank you, Fundile, for the introduction. I thought you asked that our guests do introduce themselves, unless they will only introduce themselves when they are speaking. I haven't seen Dr. Kamlashe on the participants list, and I also haven't seen Dr. Ayanda Mute. I see and Mr. Nkululeko Nxesi, I don't see. I do see Mr. Jimmy Kochana and Ms. Nomfundo Jajula. Oh, Mr. Nkululeko Nxesi, I've just seen now. So would we want to start with the colleagues that are with us, and the others will join us?
Yes, I think let's go ahead with those who are here.
Thank you very much. Colleagues, as Fundile said, we actually have been looking at how the Eastern Cape has become very badly affected by the COVID virus. Initially, the Eastern Cape was similar to other provinces where we actually had Gauteng and the Western Cape as the epicenters. And in time, we then saw the Eastern Cape rise very sharply, and it's now overtaken even Gauteng in terms of the number of cases. This has been very concerning for most of us, taking into account that the Eastern Cape is one of the more underprivileged provinces in terms of economic development, in terms of infrastructure, and therefore, if right now we are seeing the Western Cape struggling to control the epidemic, the worry is when this is in full force, as it is becoming apparent now in the Eastern Cape, how will that province work with the challenges I indicated it faces? So if you agree, colleagues, I will, we have got a Bob Naidu. I am not sure. Bob Naidu, are you one of the speakers? Fundile, if you can confirm for me.
I think he must be representing either the municipality or the province, but he can introduce himself.
Yes, thank you. Thank you very much. Thank you very much, Chair. Yes, my name is Bob Naidu. I'm representing Buffalo City Metro.
Thank you very much.
Good evening to everyone.
Okay. In that case, I will take you as you had been mentioned by Fundile. I don't see Doctors Kamlashe and Miude, and therefore I'll start with Mr. Nkululeko Nxesi. Mr. Nxesi, you can introduce yourself and maybe just indicate, your impression of the challenges in the Eastern Cape, and probably challenges then also goes with what you believe are the things that we should be doing as the Eastern Cape and also as people who are outside the Eastern Cape. I hand over to you at the moment, Mr. Nxesi. Thank you.
Thank you very much, Sis Tutura, and I would like to take this opportunity to also thank Dr. Nyati for inviting us to this platform, and also to say hello to my fellow panelists this evening. So today I'm wearing a cap of being an executive director of an organization called Men and Boy Foundation. So Men and Boy Foundation is an NPO that is working to mobilize men and boys to create a society that is free from social ills, addressing issues of gender-based violence, and also ensuring that the men and boys they do look up to their health. So Men Boy Foundation has been working in the country, and particularly in the Eastern Cape province, addressing the issue of the injuries and the death of traditional initiates. So because of that, we have interfaced a lot with the government of the Eastern Cape, and also with the communities and other various stakeholders that are involved in ensuring a safe traditional initiation. I wanted to make that background because I wanted to draw some similarities between that issue of the deaths of initiates and the COVID-19, and also just trying to link what is happening today or currently with the other epidemics like HIV and AIDS that we have been involved in. So just to answer your question, Chair, about my impression about the Eastern Cape as far as COVID-19 is concerned. I think to start with, I am not surprised, and as the Men and Boy Foundation, we are not surprised by the current developments in the province. We actually anticipated this because when this whole thing started, the first reaction of the population of South Africa in the main was that of denial. That no, this issue of COVID-19, it's a Western issue, it's a Western a virus, the same manner in which people reacted when HIV and AIDS started in our country. That HIV and AIDS was seen as a European disease. At some stage, it was seen as a white man disease, and also it went further to be seen as a disease of people who are in having a particular sexual orientation. So coronavirus, as well, has been seen with that, and then therefore people were taking this thing lightly. They were even making jokes about it, laughing about it, and then when it came into the country, there was the first case that was reported, and then people said, no, this thing is from KZN, and the fact that it came through the airport, it proved their myth that this is not a South African thing. And there was even a view that Black Africans are actually immune from getting this virus, and then that fuel is wrong perceptions that it's not going to infect Black people, and then that led to how people responded to it. Now, but now we're seeing a different situation where the infection rate is rising, and then one of the causes of that is that when you go to Eastern Cape, and then when you hear also the reports, particularly in rural areas, probably because of many issues, people are not observing the lockdown regulations. In rural areas, people are working as normal. The issues of people attending funerals and so forth. So those issues are contributing to this rapid spread of the virus. So our impression as Men and Boy Foundation is that unless something drastic is done, the situation is going to be worse. However, we are not shocked. We actually anticipated this kind of development of these set developments. Thank you very much.
Thank you very much, Mr. Nkosi, for that insightful analysis. We do have Dr. Kamlashe on the line. Thank you very much for joining us, Doctor. So I will do a short recap of what Mr. Nkosi said, where he was trying to say that, he's got vast experience in the control of similar challenges, the death of initiates, HIV, and they anticipated this. They saw the denial as happened with HIV. Also the labeling, where people see this as other people's disease, it's not them. And in the rural areas, he says, there is no observation of, the regulations and rules that have been put out. and people, funerals, continue to be a source of infection. I will, at this stage, colleagues, say that we have got an hour. We have till 9 o'clock, which means we are now on about almost 1:15, and we need to manage our time very judiciously. And so I will give each person, maybe Dr. Kamlasha will have a little bit longer because he is from the province, and he was supposed to be the first speaker, and he is now going. I'm going to ask him to please set the scene for us in terms of where are we and what he sees as the major challenges in the Eastern Cape, and what he also believes could be the solution that we can look at. I'm going to give him about 10 minutes, and if you other questions, I'm going to 5 minutes because I do also want us to have time for interaction on this matter. Dr. Kamlasha, if you could kindly then introduce yourself. We welcome you, and then go on with your presentation. Thank you.
Thank you very much, Tutula. Thank you very much, Fundile, and colleagues in the panel and everyone else listening and participating. It's really a great pleasure to be able to share the aspects related to COVID-19 and the Eastern Cape problem. A lot has already been said by Mr. Nlesi in relation to what's going on in Eastern Cape. I'll bring in a few perspectives, which are obviously part of our intervention as the Eastern Cape government. The first one is that a lot of lessons are being learned by the health system in South Africa, not just in Eastern Cape in relation to COVID-19. Number two is that when we talk about COVID-19, there's just one little thing I want to clear out immediately. Because when we talk about weaknesses in the public health, people think about the Department of Health, because it's usually the nomenclature is that of public health and private health. When we talk about public health practices, we talk about all the things that the president and the national minister and all our MECs and premiers talk about. The washing of hands, the cough hygiene, the social distancing, and the wearing of masks, and all other related health determinants, which are a big problem in South Africa, Eastern Cape in particular, and other provinces where poverty levels are high. So I just want to clear that. Number two, as Eastern Cape, yes, we're witnessing the numbers are going up. And again, as Mr. Nlesi was saying, it's not a surprise to us as Eastern Cape. However, one of the things we must say when we interpret these numbers, it's not just statistics. These numbers, like many South Africans, they don't see these numbers as a barometer of social behavior. They just see them as numbers of infection. Yet they are a clear reflection of social behavior. That goes against all the measures that have been put in place around levels of lockdown and other regulations that are put in place. I just want to make that appeal. Eastern Cape is very badly affected in relation to social behavior. It is one of the poor provinces in the country, and we do know that it is a labor-sending area, one of the biggest labor-sending areas. It is connected to all the pandemics in South Africa in one way or the other. And as it is expected, when disasters strike, everybody wants to be closer to home. It is no surprise that people in their big numbers and droves are leaving Western Cape, especially the sickly ones, and coming to Eastern Cape. And that has an effect, of course, on our numbers. Because one thing for sure, COVID-19 doesn't recognize our federal system in South Africa because we are so separated into 9 health systems. The COVID-19 is attacking one country, that is South Africa, and the people of South Africa. So Eastern Cape is linked to Gauteng, it is linked to Western Cape, it is linked to KZN. It has got its own challenges that relate to social behavior. So that's how we understand all the numbers. And therefore our interventions have some element of uniqueness in terms of dealing with the situation beyond what is generally done in other parts of the country. Number two, if you allow me, you said give me 10 minutes, I'll just use 8 of those. We appreciate that also Eastern Cape health system has always been under pressure, like any other, like Gauteng, like any other. It has always been under extreme pressure from a high burden of disease, tuberculosis, HIV, like many provinces, and now instant is COVID-19, with a very high levels of poverty. So we are dealing with a distressed health system that is now overburdened by COVID-19. So as Eastern Cape, we are dealing with the outcomes as we see them. We appreciate our recovery rate, which is actually above 50%. We are obviously distressed by the death rate, which is now sitting at 101 as of today. That's about 2% of our active caseload. We're worried, but we further appreciate the commitment of our workforce. And I know that in the public space, there's been a lot of publicity around strikes in hospitals. We're dealing with those issues on a day-to-day basis. As I'm talking to you now, I'm from All Saints. And we must understand there is a workforce who are also human beings. And I think Mr. Nesi talked about fear, about ignorance, about panic. So we are managing that on the workforce. And as we continue to make successes in those areas, we are seeing improvement in the quality of our response to COVID-19. We must also notice that our testing statistics, we have reached our 1%, which is what is called an essential target. That is 1% of the Eastern Cape population. We're at 64,000 now with the number of cases that we have released. We continue to improve our targeted testing so that we can be able to control the epidemic. We're also improving on the isolation. There were weaknesses that we identified, especially in relation to individuals who go out to test privately, and some of them are handled by some private hospitals, and they generally don't follow the protocol. In other words, they don't isolate, others choose to self-isolate without us being aware in the public health system. And those who cannot cope with that, they go into the social media, and we are trying to handle that. Tomorrow we're meeting Life Healthcare, which is our biggest private healthcare provider in the province, in order to close that gap. So there are challenges, there are areas that we're showing progress, and there's still more work to be done. Thank you very much.
Thank you very much, Dr. Kamlashe. I think your message was very encouraging in terms of especially, looking at your staff and appreciating them, because they are the backbone, and should they fall down, and then the whole thing will not survive. And it also brings up issues of PPE, which I think we can go into next. During this discussion. And you have also outlined very well the history of your province, the social behavior, but also very critical, the impacts of being a labor sending area, where actually we saw people moving from Gauteng and Western Cape during the lockdown. And we were all worried about the elderly people who are mostly in the rural area. I think I will leave it at that and invite our next speaker, Ms. Nomfundo Jajula. You have 5 minutes, ma'am. Thank you.
Good evening, ladies and gentlemen. Thank you for hearing me.
We can hear you, although your line is not the best, but just continue. I'll indicate when it really becomes very bad.
Okay. I'm sorry about that. My name is Nomfundo Jajula. I'm the chairperson of the National NPO Congress, which is the national network of NPOs in South Africa. And I represent Eastern Cape. what I would just want to comment on, to top up on what the other speakers have indicated, I would like to indicate the fact that one of the challenges as the NPO sector is basically not to being recognized, and so that we can also participate and actively in trying to assist with the numbers that are increasing for the COVID-19 infections, and would like to plea as this sector of the NPO sector to government to please, if they can sit with us, have a conversation with us, allow us to participate, because we are basically as NPOs. Yes, we don't have resources and would like to have resources, and so that we can be able to assist within the communities to make a difference and participate in reducing the numbers of infections.
You are doing very well. I don't know if you have been cut off now. Okay, it looks like Nomfundo has run into a problem, but I think she did outline very well, you know, that they are the NPO sector and they are ready and willing to assist, especially with communities. And we actually are at a point where all hands are needed if we are to beat the virus. So at least she did transmit her key message. I do hope that Nomfundo, you'll be able to join us later, maybe during the open session. We will now move to Mr. Jimmy Gochana. If you could please introduce yourself and provide us or give us your inputs. Thank you.
Can you hear me? Can you hear me?
Yes, we can hear you.
Oh, okay. Good evening to everybody, in particular, Dr. Fundi Nyati, for making it possible to try and ensure that indeed we participate in this panel discussion. My name is Jimmy Kochana. I'm the current national president of Sangoko. Sangoko stands for the South African National NGO Coalition, as well as the deputy president of the Alliance of NPO Networks nationally, which is constituted by 4 national networks, Sangoko, Sakono, Sanpof, and Nampof. So I'm here in particular representing the NPO sector, which I think is playing a critical role, as it is a coalface at a community level in working with government. But I must say that indeed at the national level, when this COVID-19 pandemic issue emerged, we were very much opportune at the national level to work closely with our government using the network community constituency platform, as well as the SANAC Civil Society Forum. So in that regard, yes, we can say we are playing a part in working closely with government. But I must say that at the provincial level, in particular the Eastern Cape, we find it very, very difficult to make inroads in working closely with government, in particular Department of Health. I don't know why this is not cascading down from national to provinces. We find it very, very much difficult to work and collaborate on programs that will ensure that we reach out to communities. And I think I don't want to overemphasize the fact that the role of the civil society, in particular the NPO sector in the country, is critical. The NPO sector is a critical stakeholder that government must indeed work very, very closely with if we want to fight this battle against this enemy that we don't know. But we find it very, very difficult in the Eastern Cape. We hear that there are so many initiatives that have been set up by our provincial government, the health department. They've got a joint command operation, I think, is sitting in Bisho, but there's an absence of the NPO, there's an absence of civil society in that. Now, the question that we want to pose, how can the government be serious in fighting the scourge, in fighting this disease, if they're leaving out a critical component, which is NPO sector? So we want to appeal strongly that government must take NPO sector, in particular civil society, very, very seriously, that we must work in partnership. Let us collaborate with each other so that we reach out to the community. Civil society, the NPO sector are playing a critical role in the country. I don't want to emphasize that, but we find it very, very much disingenuous from the part of the government, in particular the Eastern Cape government, that they are not serious. They're just paying a lip service that they want to work with us. But in reality, nothing is tangible to prove that effect. We're working at the national level without funding. At the provincial level, they can't even involve us in programs that we could benefit. They're using the CDW. There's no problem in using the community development workers, but please ensure that community-based organization that knows the plight of those people, ensure that you bring them on board and work with yourself. Otherwise, it will defeat the whole purpose of trying to achieve your objective of fighting the scourge. I thank you.
Thank you, Mr. Koityana, for a very impassioned plea to government to say that you also have got your hands ready to assist. And right now is a time when everyone who is offering a hand should be welcomed and brought on board in this fight. As you say, the community health workers are there, but these tend to be young people that are not very influential. And the role of the NPOs, the NGOs, traditional leaders, and other leaders in society is that they do have a standing and should thus be utilized, especially now, in mobilizing communities so that they can listen. The social behavior that was talked about, it can only be addressed by credible leaders in society who can show and assist society to adopt, the practices that we want them to adopt. On that note, we actually, I think, will be going on to a good person, which is Mr. Bob Naidu from East London, in that he is also part of government. And we hope that in his presentation, he'll probably also touch on how, communities are reached through organizations. Welcome, Mr. Naidu. I hand over to you.
Thank you, Chair, and good evening to everyone. And thank you for the invitation. I'm hoping that you can all hear me. Yes, you can all hear me. Yes, okay, thank you very much. And thanks for the invitation. I bring to you then a municipal perspective on some of the challenges and interventions we are making here in the Eastern Cape, in the Metro. Dr. Kamash has also mentioned quite a bit. We work very close with him and his Department of Health. But from a municipal perspective, you will understand we deal directly with the communities. We're in quite a unique municipal area. We are although we are a metro, we are a very big rural area. And also we have many, many informal settlements. I think we have over 100 informal settlements. And our function entails providing basic services. And we know how important that is to make sure that people and the community are given and comply with the hygiene protocols. So we are responsible to provide the water, the sanitation, roads, and electricity. But in doing that, we need many, many role players. We can't do it ourselves as a municipality. And for that reason, together with the Premier's office, we are part of the Joint Command Council represented. So we've established what we call the Mayor's Command Council, which is an internal made up of the decision-making process. I'll very quickly touch on the institutional arrangements. And then we've got what reports to the Mayor's Command Council is the Municipal Multidisciplinary Command Council. This is more the technical administrative wing. That's where all the work is done, and it's represented by many organizations, other government institutions, the labor, business, and community organizations in general as well. And what we do, we look at the various aspects, health, we look at the health and protection and security, we look at infrastructure and public services, we look at municipal services, we look at LED, education, social services, we look at internal logistics and legal issues. The municipality is one of the biggest employers in the area, employing about 6,000 staff members. Some of the challenges we found was non-compliance with the disaster management regulations, the huge poverty levels that is in our area. We have a very big community that is unemployed. So we had to provide certain basic services to them. What it meant, we had to redirect some of our municipal funding. And recently we have made available 23 million that we have purchased food parcels for the poor. We have also provided hygiene services such as soap, etc., water to areas that never had water before. That meant that we had to sit and then relook at our budget. So I would say at the moment in the municipality, we're spending 70% of our time, both administrative, politically, and directing our resources towards the COVID and those affected by COVID. So we are instrumental together with the Department of Health of looking at field hospitals, which we are busy with at the moment, which will cost quite a number of hundreds of millions of rand. With the Department of Public Works, we are looking at isolation areas, quarantine areas. We must make sure that the city is kept clean. And for that, the mayor has also launched on Fridays, a clean and green Friday, where we get involved with the community. Also, notwithstanding that we must comply with the disaster management regulations in terms of social distancing, to clean areas and to get the community involved and the awareness as well. There are a number of radio stations that our politicians speak on. So these are some of the initiatives we put in place to make sure that we provide services, we up our standard of services. I think ACES Plan, which is an NGO, also recently undertook a study and said that, during the COVID, we have upped our game and much more people now have access to our services. Financially, we've taken a number of decisions to help our communities. For example, we have stopped our disconnections, the credit control policy we have reviewed. We are now making arrangements for those people who can't pay. We have stopped all disconnections, making it easier for people to have access also to services, even though they may be unemployed or they may be without a job during this COVID season. But it's many, many challenges. Funding is one of the challenges. We work together with the Department of Health on the PPEs. Recently, there's been a good supply and flow of PPEs into the metro. So we don't have too much of problems there. We are working with other organizations to help with the disinfection. And so for now, I think with the many, many challenges, we got a good, strong, I would say, a institutional arrangement with many, many government institutions and the public out there that assist us. But I think what we're all concerned is with the huge number and the rise in the COVID cases, and that is putting pressure on our resources. Chair, I think let me stop there, and thank you very much for the opportunity. As I said, I'm representing the Buffalo City Metro, and at the moment, I'm the acting city manager. Thank you very much.
Thank you very much, Mr. Naidu. I think you have outlined, the challenges of the municipality, but also importantly, the new things that you have taken on board, such as hygiene services, more water to the people, because if people don't have water to wash their hands, then we can't start fighting the epidemic. You've also said PPE is not a problem in your area, and you ended by saying, though, that there has been the huge rise in cases. And we have had our speakers, and I'm going to suggest that we go around each of the speakers for them to indicate what they think is a key intervention that would make a difference in the Eastern Cape. We all have recognized that the province has got an exponential rise in the number of cases. We all have indicated what is going on, but I would like you to say what you think is the one thing you believe can make a difference, for that region, if that was to be implemented. So we're looking for solutions now. I will start then with our first speaker. Mr. Nxesi, you were our first speaker. So we'll go in that order. Mr. Nxesi, Dr. Kamlashe, Ms. Nomfula, then Mr. Gochana, and last, Mr. Naidu. Mr. Nxesi.
No, thank you. Thank you, Chairperson. I always believe that there is no social ill globally that can be addressed by government alone. All government throughout the world, they have actually failed to address social ills when they are working alone. So our view as Men and Boy Foundation is that what could help in Eastern Cape, like in other provinces, to arrest this rapid spread of COVID-19 is actually the social mobilization and empowerment of communities. Not only relying on the security approach in terms of enforcing the lockdown regulations. Many community people, they are not adhering to these regulations, not because they don't want to, but because they don't know. So our view as Men and Boy Foundation is that government, as Comrade Nomfundo and Comrade Jimmy have alluded, government must engage the civil society with honesty and ensure that they are involved on the ground with a specific sort of role, that of mobilizing communities and educating community. Because once communities understand the importance of all these regulations, communities are going to comply. Just last point quickly. The problem that we are seeing nationally, including Eastern Cape, there's this hit and run approach, and this epidemic has been biomedicalized. Again, that's how governments normally respond. To epidemics, they just biomedicalize them and think that if you bring a biomedical intervention or perspective, we are solving the problem. So we want that to be complemented with social interventions, and social interventions are best placed at the civil society level, to be addressed. And this Hollywood style approach where you see MECs and ministers going from left and right, and as if they are doing us a favor. They take pictures even when they are doing the things that they are supposed to be doing. It can't be accepted. So let the civil society be involved, and let education and empowerment program be enhanced. That's how we managed to arrest the spread of HIV and AIDS in this country. We fought for the social interventions to be implemented equally with the biomedical approach. We're not saying this or that. We're saying both approaches must be respected. Thank you very much.
Thank you, Mr. Nxesi, and you are very right. That is the basis, The Eastern Cape, in fact, there are very few governments that have out-treated this disease including America, it failed to outtreat it. And the Western Cape is struggling now to treat the disease. And therefore, the Eastern Cape, the last thing it can do is to outtreat the disease. It has to be prevention, and that prevention starts with the education of the communities. So thank you for that contribution. Dr. Kamlashe, the one thing you think can make a difference for your province? Unmute yourself, please.
Thank you. I think first of all, I must welcome the offers from the colleagues and the NGOs that are in this panel. And I would do everything possible, get their contact details, get them to join the bandwagon. Maybe one of the things we don't do very well, and they may be correct, is that Eastern Cape doesn't get the media coverage that everyone else gets. We have a very broad and well-mobilized civil society that is participating in managing COVID-19 in Eastern Cape. We've got more than 30 NGOs actually on the ground, but we need more people to assist us in dealing with this problem, right at local community level. That we admit, that we agree, and we welcome that. We are also appreciating, the support that we are getting, even from private business. I'm sure you are aware that setting up of the field hospitals by VW and some municipalities like Nelson Mandela Metro and even PCM, as Bob Naidoo has already mentioned, that is all a concerted effort in terms of dealing with this problem. I must say, we're very privileged in Eastern Cape, and I think I've looked around the country. Eastern Cape and KZN, their approach to COVID is very unique. There's a lot of political cohesion and coordination, which involves all other departments. And in Eastern Cape, we are in the same position, but we still appreciate what Jim was saying and Utulas and other colleagues were saying, and we welcome those. But political leadership, colleagues, is very important in all these things when we deal with civil society. And Eastern Cape, we have a very strong political support, starting from the councillors and the mayors. There's still a lot to be done, obviously. But ultimately, there are aspects that relate to Eastern Cape and other poor households. When we talk about these concepts of isolation and quarantines, when it gets to certain rural environments, there's got to be a lot of adaptation. Because in many cases, it's very easy to take isolation as moving someone from their household to a hotel. But it gets quite complex. While it is absolutely necessary and important to control the spread of disease, but how you do it should not in any way impact on the dignity of the people and cause more social harms. In poor societies, heads of families, and we need to approach them with some degree of dignity and give them all the options available. It's not a very mechanical issue, as it sometimes seems to be. In Eastern Cape, you have instances where if you confine people to an environment, they have no access to food, they have no access to all other services, which are usually within the lockdown radius in some of the urban areas. So for them, it means a lot of traveling to get the basic household. So as NGOs come through, it would be good that identify certain niches that will make people move less and be able to stay at home, as it is the anchor of the interventions. And we really appreciate and welcome all the comments and suggestions that have been put across by all the other panelists. And we appreciate that. The diverse stakeholders, up to traditional leaders, they are all part of our interventions. Traditional leaders, Chief Nonkonyane is part of the Provincial Command Council. So we welcome those and would love to brief our colleagues in the panel who want to come to Eastern Cape. Certainly, it cannot be difficult or impossible to work with us in Eastern Cape. We're a very open province, and we appreciate all the opportunities given to us, including the one of having this kind of a conversation. I also want to thank you that you made us a focused province, and would love to do more and have more of this and mobilize our people and use all forms of platforms available at our disposal to assist our people to comply with these regulations. Without them doing that, we're in trouble. a reality that we're accepting, Mr. Nyati, Dr. Nyati, is that we cannot be separated completely from Western Cape. And we do not necessarily want to force to be separated from Western Cape. We share about 30% to 35% of the population between Western Cape and Eastern Cape. And if we get more test kits, we'll be able to penetrate and do more tests in the province. I think all of you are aware that the number of test kits that are distributed across the country are also related to availability and the supply, as these test kits are imported. We have mobilized other partners, and we have been assisted even by Solidarity Fund in terms of expanding our testing capability. I think Mrs. Gloria Silobe is sharing that. They've mobilized and they've done so in the country and in Eastern Cape to bring in other pharmacies like Discam in order to expand the testing capacity. But most importantly, ultimately, we do everything for just one purpose, not just numbers, not just activity, but to prevent loss of life. We are beginning to focus, as Dr. Palf was saying, on protecting the vulnerable groups, which already the statistics and the biometrics statistics that were mentioned here are beginning to show who is likely to die when they get the infection. The people with comorbidities. We are beginning to adopt a defensive stance as a province in respect of protecting those groups before they get infected, and also to reduce the influx into our systems, because they can actually collapse, the health system. We are doing everything possible to increase the number of beds in the province as part of increasing our institutional capacity to respond to those cases that require admission. And I must admit, colleagues, it's a tough call and it's a difficult one. We are fighting an unbeaten champion here. And I think anyone who's got a knockout punch is welcome to help us win this battle. Thank you, Dr.
Thank you, Dr. Mkamlashe. I didn't quite pick up what you think is a key challenge. I thought you were talking test kits, but then you said no, Solidarity Fund has provided those to you, but we will pass. When we come back, I would like you to talk more about the vulnerable people. How you are protecting those, especially pensioners, the queues that we see, pensioners at 5 a.m. sleeping to, get money. It's a recipe for disaster where they catch COVID in those congregate settings. So I would like you to prepare to answer that. So let's continue with our, what is the one thing that you think can make a difference for the Eastern Cape? And I think we are now going to Mr. Gojana. No, it's Miss Jajula, sorry, Miss Jajula.
In conclusion, Chair, NANPOC is here to help and assist wherever we can. And we have people that are qualified within the NPO sector. We have people that are qualified to support and give emotional support, counseling, screening and testing, and also wellness program. We can also assist in the distribution of essential services. We are here to partner with government and holders so we can see this and see this through and able to conquer. Thank you.
Thank you, Ms. Gojana. I think you, Ms. Jajula, you were very clear. And of course, this is an area that we always overlook, the issue of mental health, counseling, and wellness programs. So again, it's extending that hand to say you are there, you are ready to assist. Mr. Gojana, what's your one sentence on what you think can make a difference for the Eastern Cape?
Let me start by saying, Madam Chair, that indeed, I must commend the Buffalo City Municipality for the active role that are playing in ensuring that they bring civil society, NPOs, community-based organization, your faith-based organization in becoming involved in that model that they have created. And I think it's a step in the right direction, Mr. Moodley. And I think we want to urge you to continue making use of the NPOs so that they assist your municipality in ensuring that you realize the objective. Coming back to what you were asking, I think it's critical for you, Madam Chair, and the panelists to know that I think South Africa has reached a new trajectory that seeks to ensure that everybody is needed. We all need each other, as Dr. Kamlasha was saying. But I think one of the issues that I think we want to appeal to government to ensure that they address is the issue of a trust deficit. We want to trust our government, but the way the government has been doing things, the way that they have not been giving support, the way that they have not been recognizing our role, we find it very, very difficult and very much not pleasing to comprehend how the government can take us into their confidence as a sector. So we want to advocate in this panel discussion that we are for a social dialogue process. At the national level, the government have created an enabling process through a social compact where various stakeholders are involved. And I think that model must replicate down to the provincial level. We want to see the Eastern Cape, ensuring that they do things the right way. And the right way is to create a necessary platform so wherein government, civil society, business, and labor, where everybody is involved with dialogue. We don't hear things that are being pushed down our throat or being imposed by government without our active participation. So we want to appeal to government to create that process so that we genuinely participate in addressing the problem that is confronting the country. We are ready. We've always been ready. We are ready even now, but we need government to take us into their side, take us into confidence that indeed we are critical stakeholders in the country. Thank you.
Thank you very much, Mr. Kuchana. Mr. Naidu?
Yes, thank you, Chair. I think what makes us not speak as a metro, it's all interrelated. I think we all welcome the risk level 3, but I must say it has brought with it a number of challenges. We find people moving freely, non-compliance with the regulations, and it means that we have to divert a lot of our resources on making sure people comply. I think you hear it nationally. We're one of the problems where people are just not complying. There's a lot of people out there, non-compliant. Going with that is the rise in the number, the drastic rise in the numbers. And it means that a lot of resources are put into what we should not be putting it and putting it towards the COVID and fighting the epidemic. Now, what have we done as a municipality? We treated this very, very seriously. The mayor has today made an announcement in his COVID meeting. We're going to now be launching what we call the rapid COVID ward committees. That means just at the grassroots level, because it's the communication that is a serious hindrance. People may be not getting the message. So we are now launching the rapid COVID ward committees. It's going to be driven by the ward committee councillors and their committees, but it's going to be a quick intervention where we will deal with any matter relating to COVID. It's infrastructure, communication, PPEs, and we feel that we can give direct assistance. So we are launching that in our 50 wards, and we hope that will be at a ground root level where it will rise up, and then we can help the communities at that level. And the NGOs, want to thank you very much for your, I think the issues you raised, the challenges you raised, we hear what you're saying. We want to make contact with you. We can't do this alone. as government. We need your help, we need your assistance. And if we have failed and not brought you on board, it's never too late. I think it's a challenge that we got no history of. We can't go in our archives and say, oh, we did it 20 years ago, 100 years ago. As we go, we're also learning. But there's no time to learn because we're talking about people's lives. So, Chair, that's what makes us not to sleep. And I think one important thing also in our region is the stigmatized. People feel that if someone's got the virus, there's a stigma, and I think someone talked about the mental health. It's a reality, and people isolate them and stigmatize them, and it's something that we'll have to also deal with because it affects a whole community, it affects a whole household and a whole ward. So it's something that we're going to have to look at as well. That's also one of our challenges. So those are the things that doesn't make us sleep in our matter. Thank you very much.
Thank you, Mr. Naidu. At this stage, colleagues, let's remember this is not my show, it's Dr. Nyati's show. I hope his sound is better because there are some questions you'd like to ask. So over to you, Fundi.
Muted.
You are muted. Can you unmute yourself?
Okay. Right. Okay. Thank you, Dr. Balfour. I just got a few questions for Dr. Kamlashe. And another question is actually, I had asked people to send questions before this conversation. So there's actually one question for yourself, Dr. Balfour, interestingly. Right. Dr. Kamlashe, there is an oversight visit that took place in Umtata where they went to St. Mary's Hospital, amongst other places. And that was led by the portfolio chair for health, Dr. Lomo, and they were refused entry at that hospital. And the CEO was missing in action. So one of our viewers wants to know, what is the province doing about that? That's the first question. The second question, it comes from one of the academics, in the province, is asking about the expected mental health burden to frontline healthcare workers and to the population as a whole. In the planning by the department, is there any factoring of this impending, challenge? Because they believe it's going to be something that will overwhelm the healthcare system. So those are the two for Dr. Kamlashe. Just one more, Dr. Kamlashe. Then the other one, I spoke to doctors, private doctors on Sunday, trying to have a sense of what is happening in the province. And they gave me an impression that public health campaigns, especially in the communities, they left a lot to be desired. So I just want to find out, is there a plan to actually lift up the levels of public health messaging in languages that people can understand, so that you can get more people adopting the preventative measures, as required? So those are the questions for Dr. Kamlashe. Dr. Balfour, somebody asked about the mining sector, that since the reopening, there seems to be a lot of cases that are in the mining sector. What do you think? Do you think mine houses are actually hotspots for COVID-19? And the link to today's discussion is because a significant percentage of these miners, they do come from more Eastern Cape, more KZN.
Okay. Let's have Dr. Kamlashe first, please.
Yeah.
Thanks. Thank you, Dr. Nyati. Let's start with the oversight visit to Mthatha. And it was one of many oversight visits that I think were referred to by another panelist. Yes, there were challenges, that we were faced with in terms of accessing Mthatha facility. And you're very much aware that, private health sector structure is very different. You find that the control is so centralized that even getting to the gate without an appointment, you need someone in Sentin, to actually authorize that. So that's their structure. I think their reaction was basically around that because in somewhat it was a surprise visit, if I had to put it that way. So we understood that and we're dealing with them. We have since engaged their national office, their CEO, and as such, tomorrow at 9 o'clock, we are visiting the East London facilities with the Premier. We are now working, far more harmoniously with the private sector in Eastern Cape, which is largely life healthcare. We also have Netcare footprint. So tomorrow we're spending the whole day from 9 o'clock to 2 o'clock together with the Premier, the MEC, and the SG, visiting them, trying to also assist them on their part because they are also overwhelmed because remember, they've got very limited capacity in terms of beds and personnel. We are actually reaching out to them tomorrow. We'll work with them. I'm sure we'll follow the developments as time goes on your part. And we need them as part of the health system because we're not dealing with public health. We're dealing with the entire health system. And number two, on the part of the mental health, certainly it's not something to happen. It's something that is happening already. I think I referred to this partly when I was talking about the isolation and taking people away from their families. Those things do affect people. It ranges from fear, from anxiety, which is part of what is going on in terms of numbers in society. And that we have to deal with. You may have noticed, I think those that are observant, if you look at our media releases on communication, I think some of you also are exposed to psychologists. Those are actually crafted in conjunction with psychologists so that we don't create unnecessary and undue fear on society and make the situation worse than what it's supposed to be. We're already working with a group of psychologists. We are now inviting many more to participate and also follow the same model that our colleagues from NGOs to say, look, it's good enough to find this in the media and in the newspapers, but it must filter down right to communities at what level? How do you then deal with those effects at what level on a mass scale? Because the last thing you need is a panicking society, which can really undermine all our efforts. So there will be long-term effects of this. And again, our mental health capacity in the province is also overstretched. As you all know that we have a problem of drug problems in South Africa and it's already pressed. But all measures, including mass counseling, using various kinds of media, and including your media from this, will be able to use these words to deal with healthcare workers and the population in general. One of the things I wanted to say when Tutula was asking about one thing that we need a high morale and confidence among our healthcare workers. A lot is happening that demoralizes them and that can destroy their confidence. We need to give that support to them every day in every possible case. If we lose that, we're in trouble. On the issue of private doctors, yes, agreed. I think more than anything else, that is the suggestion. If they say our company is at community level a week, we're bringing them on board as well as a stakeholder and as partners to this war against COVID-19. We'll be working closely with them. We understand they have people in their own rooms who are very vulnerable, who sometimes need a special kind of education and awareness beyond what is general awareness about COVID-19. I think most of you have heard what happens in some of the practices where outbreaks do happen. We were going to work very closely with them, and we're already making contact with the various associations which they belong to. Some of them are IPAs, others are in SAMA, others are in the new organization that has been formed for this happen. So we're working closely with those, and we'll continue to improve our relationship and make sure they participate more and more in all our campaigns, which must happen in every corner, where people shop, where people work, where people are in the transport systems, and where people are in terms of seeking healthcare. The campaign must be much bigger, which I think is exactly where our NGOs will play a very big role. And we welcome their participation and offer in that regard. Thank you very much.
Thank you, Dr. Mkamlashe. I will answer my question, and then there is the outstanding question I said I would ask regarding vulnerable people and how you are protecting them, and then we'll move towards wrapping up. Regarding mining, of course, mining and the Eastern Cape, those are words in one sentence. If you talk, the Eastern Cape is one of the largest labor sending areas in South Africa, both to Gauteng, to Western Cape, to Natal. And it was actually very saddening at the beginning of the lockdown, the first initial lockdown, when people started moving from the then epicenter, Gauteng area, down to the Eastern Cape, which at the time was similar to the other provinces with low prevalence. And at the same time, people were moving from the Western Cape to the Eastern Cape. And I think we underestimated and actually forgot that there was one Cape province. So there is an artificial boundary between the Western Cape and the Eastern Cape, whereas that is one province and used to be one province. And so when the lockdowns came, people went home, which was to the Eastern Cape. And unfortunately, what it meant is people were moving from high prevalence areas, both in Gauteng, where there is also mining areas, into the Eastern Cape, which was then going to result in the vulnerable people. Our homes are full of grannies because the working class people are away from the Eastern Cape. So that is quite unfortunate. Regarding specifically mining at the present moment, we in the mining sector are doing far more testing than is the case, within some of the provinces. There have been major challenges with test kits. And so at some stage, some of the provinces have had to stop testing the mass screening, of people that was going on. And so at the mines, we still continue to do, we try to follow NICD guidelines, but a number of mines go broader than that, and they test a significant number of their employees. And once you start testing, then you see that there is quite a lot of virus actually, which is circulating. And I'll close that off by saying, miners mostly stay in communities. And the fact that we can pick up so many infections in miners means it's probably similar in the communities that they are staying in. So if I can then move to Dr. Mkamlashe, we seriously were worried about, seeing the queues of old people. Those are the most vulnerable. And when they have to then queue over 2 days to get their pensions, it is fertile ground for the transmission of disease. So I wondered if the government in the Eastern Cape and in other areas actually has considered to stagger the payment. Number one, as far as possible, to put deposit money in people's accounts, but also to stagger so that people, it's not only on the first 2 days that then people all want to go and withdraw, but right through the month, people, maybe the number A to C, it's on the first, and number D to F, it's, you try to cover the whole month so that people don't crowd on the one area. And I don't know if there's any other ways in which you are educating the pensioners, regarding COVID, so that they can protect themselves against people who might be visiting them at home and actually bringing the disease. So if you could just highlight to us some of the interventions or what you think of these proposals. Thank you.
Thank you very much, Dr. Palfo. I think as Eastern Cape government, we're working very closely with the South African Social Security Agency. which is coordinated by Department of Social Development at a provincial level, as you're all aware. They are part of our intervention teams, and they participate in all the forums. They've already started staggering payments, whether it's based on benefit category. Some of them these are child support grants, others are old age pension, other disability grants. They've already started staggering those payments. I have observed that there was a bit of an improvement in the last payment cycle in terms of crowds and the queues, but it's still not satisfactory. The risk is still high. You may have noticed, I think they were on TV, where they've mobilized community development workers, even police and SASSA officials to actually manage those queues to maintain the social distancing. What is inevitable? It seems that people, when they get their money, they go to town. SASSA has gone further to reactivate the village-based pay point. Remember, in the olden days, they used to deliver these to the villages. They've reactivated with one of the banks, the ATMs. They do deliver the money to the villages, but there are no shopping facilities in the villages. So people still take taxis back to town. There's even another initiative to begin, to provide mobile supermarkets. All of those efforts are to try and prevent people leaving their own localities and going to town. So all those, with time, they'll get better and hopefully have the desired impact and effect. The other people who are vulnerable that we're looking at is not just around the pay point, is trying to keep the elderly people at home confinement. But that means then there's got to be this comprehensive household support in terms of hygiene supplies, your mask, your sanitizers, your water and soap, so that you make sure the elderly people can be semi-independent in a household. You'll appreciate in the villages the advantages. They tend to have a bigger space and more houses within the same household. So we're trying to do that with social development to keep people at home safer within their home environment. That is just one of the things. The other vulnerable group, obviously, is the workforce, especially those with comorbidities. Others are older. We are now actually exploring, DPSA has already issued a circular to see how we can be able to reduce their exposure, at the workplace. Whether that means pulling them back from the front line. As you may have seen, the deaths of healthcare workers, those are the most affected people. That is being done, and very soon, in a matter of weeks, there'll be action in that regard. So we can pull them back from the front line. It's a decision we can't take alone as a province. As you know, it affects all other people, and TPSA has to give that some kind of guidance in terms of how it is to be done. Another area we're looking at very seriously, an inadvertent or unintended outcome of COVID-19 is the collapse of other services that are attending to chronic conditions, your hypertension clinics, your ARV clinics, and everything else. And those sometimes, because there's so much concentration on COVID, sometimes some of those of our clients do suffer. So we must protect them because they remain vulnerable. We must make sure that those services are sustained and they are strengthened, especially under these circumstances. So there are a lot of things that we're trying to do around vulnerable groups within the health system and also at a household level and at the workplace. Industry has to be part of this. We can't do this alone. Private industry has to participate. They also have vulnerable people. So we have to work together. And again, I echo what has been said by my other colleagues. In order to make that desired impact, we need to work also with private industry so that we are able to achieve what we would love to achieve, minimize the number of deaths and reduce the morbidity that is associated with COVID-19. Thank you.
Thank you very much, Dr. Kamlashe. As I said, we'll move towards wrapping up. So I will do my summary of what I thought were the key issues, and then Dr. Fundile, the host, will close. I think it was a fruitful discussion, colleagues. The key thing coming through which I am happy with because it is on the prevention side, is the social mobilization for behavior change. The need for all of us to pull together, especially the community-based people, the NPOs, the NGOs, to the traditional leaders, faith, every leader, to ensure that our society understands and is educated about the disease. That will really take us quite far so that people can understand the need for all the regulations that have been put in place. Again, the utilization of all hands on deck. There is no one to put to the side at the moment. The public sector, the private sector, all arms, of society need to be fully utilized if we are to make an impression. The protection of vulnerable people, it was heartening to hear the strides which have been made by the Eastern Cape to try and protect vulnerable people. As I said, the Eastern Cape has got very high numbers of elderly people in the province compared to provinces such as Gauteng, where actually it's more full of working people, including Fundi and I, who are here, whilst our parents are down in the Eastern Cape. So that will make a huge difference because those are the people that are likely to have severe disease and to die. And therefore, if we protect those, we can actually ride out the epidemic with least impact on the number of deaths. The last point is the protection of the health worker, because with those health workers, whether it's because of lack of PPE and they get infected, or because their mental health is not supported and they break down, their breakdown really will have a major impact on the services that need to be provided by the province. And therefore, we all need to do everything to support the health workers in this case. I will end there and hand over to Dr. Nyat to thank everyone and to close for us. Thank you, colleagues. Unmute yourself, Dr. Nyat.
All right. Thank you very much, Dr. Balfour, for actually thank you for carrying this conversation. I think it was a fruitful conversation because for us sitting here in Gauteng and looking at the numbers, it's really, really worrying. I would say, we can see an avalanche, going towards the Eastern Cape, and we also can see what is happening in the Western Cape. The healthcare system there is actually choked by the number of cases. And because we know that Western Cape has a slightly better healthcare system, for historical reasons, and we know that the Eastern Cape is challenged because of historical reasons. So we worry that when the numbers come to the Eastern Cape, we're going to see a lot of casualties. And it is for that reason that we felt we need to have this discussion, have different people giving us ideas. And it's not about pointing fingers, but it's really about saying, what can be done better? Where can we, even if we're in Gauteng, where can we add value, so that we can, in one way or the other, strengthen the response of the province. I was interested to hear from Dr. Kamlash, and he addressed quite a number of issues. Yesterday or a few days ago, we saw some report that the Western Cape government had shared with the president when he was down there last week. There's a lot of insights that have come out from the Western Cape in terms of, percentage hospitalizations, the drivers of death, especially issues of comorbidities, that is people who already have got pre-existing illnesses, And I think it would be wise for the Eastern Cape to learn one or two things from what has been seen in the Western Cape, so that if possible, some of those things are addressed before the health system is challenged. So with those closing comments, I want to thank all the participants, all the panelists. You enriched this discussion, and I hope that this is not the last time we are discussing these matters. We will, from time to time, call you again, either as an individual or still as a group like today, to say, where are we? So I want to thank you all, and I also want to thank all the viewers who have joined us this evening. So with those words, goodbye to everybody, and thank you, thank you, thank you.
Thank you very much. Thank you for having us. These are quite rare opportunities that the civil society is engaged. You see, when the biomedics, they meet the social interventions, there's power in that. Thank you very much.
Thank you. Thank you.
Thank you. Thank you. Thank you, Doctor.
Thank you, Bob.